Welcome back. It is Wellness Wednesday. Big news on the COVID front. Vaccines are now approved for children ages 5 to 11 years old.
Joining us live now at the table to talk about it, Dr. Dale Bratzler, Chief COVID Officer from OU Health. A lot of parents have a lot of questions, so thanks for talking to us this morning.
My pleasure.
Absolutely. Question number one, I think all parents are saying, how safe is this? Because it's up to the parents to decide whether to get their child vaccinated.
So first thing I'll say is that when we look at everybody 12 and over, the vaccines have been incredibly safe.
Okay.
Very few side effects. But with this particular age group, the company Pfizer studied 4,600 kids. More than 3,000 got the vaccine, and they did not see any serious adverse events in that trial. The vaccine was very effective, 91% effective at preventing symptomatic COVID-19.
So when you start talking about children as young as 5 years old, what is in this dosage? Is it a less dosage than what adults get?
Is it the same mix?
Yes, so it's the exact same vaccine that adults get, but it's 1/3 of the dose that we give to 12 and older. So it's 10 micrograms versus 30 micrograms. So you would expect fewer side effects with the lower dose.
Is it 2 shots, 1 shot? What is it?
2 shots, 3 weeks apart.
Okay.
Just like adults.
Okay.
And what do you tell parents who are hesitant about doing this? Because I talk to a lot of moms that are like, I don't know if that's for my child. What do you tell them?
Well, so I certainly understand it, and I think it's important. This is a new vaccine. The vaccines we've given, you know, more than approaching 200 million doses of this particular vaccine in the United States. So we know now that the vaccine is very safe. In this age group, the study showed that it was very safe. There were no serious adverse events reported by Pfizer in that early clinical trial. And of course, the kids who got the shot had kind of the same side effects that you or I might have. They had some muscle aches, sore arm. Some had a low-grade fever, but those were all short-lived over just a day or two.
So I guess this is the vaccine talk. What about the virus on this age group? What do we know about that in reference to why your child should or shouldn't get vaccinated?
Yeah, I think a lot of people aren't aware of this. So there have been 1.9 million cases of COVID-19 in this age group in the United States. I counted in Oklahoma just under 35,000 cases of kids in this state infected with COVID-19, 5 to 11-year-olds. And about 350 of those kids ended up in the hospital in Oklahoma. And some have developed that MIS-C, that syndrome, that inflammatory syndrome that sometimes occurs after you recover from COVID. So it is a serious illness in this age group. But I think just as important, we've all seen the disruption in the classrooms. This year, we saw so many classrooms have to go home, go virtual, kids in quarantine. And so it's just one more step to getting back to normalcy, letting us keep our schools open, which I think is really important for kids in this age group.
Yeah. And so for parents, I think, you know, who are trying to make this decision, and say they have, you know, a child that's 5, so young, and they think I might need to wait a little bit. What is the bad side about waiting to do this?
Well, of course, you know, we're still seeing 600 new cases of COVID-19 a day in Oklahoma, and that's just the people we know about that are actually getting tested. So the disease is not gone yet. We're approaching the holidays when we're going to be bringing families together. And one of the things that I'm concerned about is that young kids, although they don't tend to get sick when they get COVID-19, they can transmit and potentially infect grandparents and other people in the family.
And it seemed like that Delta variant really kind of went through our kids even faster than the original COVID.
It did.
One more question as we have time. Do you see a vaccine for children younger than 5?
I think that there possibly will be. It's actually in clinical trials at this point.
Oh, wow.
Though I think it'll be a while before we have an emergency use authorization in younger kids.
Best advice, talk to your pediatrician.
Absolutely. I think talk to your family doc, your pediatrician about getting the vaccine.
Dr. Bratzler, thanks so much. Always such good sound advice. We appreciate you coming in today.
It's my pleasure.
Thanks so much.